Have you ever looked at your salary and thought there's no way you could afford medical aid? Also, have you ever looked at your budget and probably cut off medical aid because either you couldn't afford it, you had to pay rent, you have to pay food, or you just needed a car? If you fall in either one of these categories, I will be giving you one of the best kept secrets on how to get the best healthcare without medical aid. Let's get to it. Okay, random facts. Public hospitals stink because, well, they're overly populated, for one. Healthcare workers in public are not the nicest people because they tend to be overworked. There's, staff shortages. There's going to be long lines. There's going to be a long theater list. You might be booked today for a surgery that might be done next year, which is facts. But before deciding on anything, take a good look at your life and a good look at what your medical needs are. If you're a sickly person or a person on chronic medication, if you tend to need to see a doctor almost every month and are hospitalized at least 5 times in a year, then, to save yourself the heartache and the headache, just rather pay for the medical aid. But if you're a person who doesn't get sick all the time, you tend to not need to visit your doctor quite often, then maybe you might consider other forms. South Africa has a public and private healthcare system. With the private, you have to pay either a medical aid or actual cash in order for you to have access. So medical aids differ based on the benefits that they offer, and the prices range based on that. But on average, for one person on a medical aid, that's pretty standard. It's at least 2,000 Rand. And with the rate of unemployment, a lot of people find themselves in situations where they can't afford. It's just the way it is. So let me just give you a couple of options for when you can't afford medical aid but still want decent health care. Number one, your closest thing to medical aid is a hospital plan. It's cheaper, especially if you're a person who doesn't get sickly all the time, doesn't really need to go see the doctor all the time, but you do want that, surety that should anything happen, you won't end up being taken to a public hospital. That's if you're a person who actually likes aesthetics, because the same doctors that work in public are the ones you pay for in private. So I guess you just have to pick your battle. If you're on a hospital plan and you have a chronic illness, that's also still okay, because now even local clinics have evolved, and the clinic will have a delivery system where you'll pick up your medication at maybe a clicks. And should the need arise for you to actually be taken to hospital, they'll pay for everything. So basically, the money that you'll be saving from the difference that you have to pay between a hospital plan and a full medical aid, put it into a savings account so that should the need ever arise for you to actually need to go to maybe a GP, you're able to utilize that money to pay for the visit. But if the need ever never arises, then at the end of the year, you spend the money and thank God for good health. Okay, let's say you can't afford a hospital plan. Identify a GP. Preferably a GP who also works in public. When you go to a public hospital with a GP referral, you sort of skip the line, because the doctor already discussed you with basically the receiving doctor. You're able to sort of skip the line, and the receiving doctor already will know about you. Even better if they know each other or work together. It sort of like speeds up the whole process. In this way, you don't have to like sort of go to casualty, wait 3 hours before being seen by a doctor who's probably gonna refer you to another doctor before you actually seen. That's why I said that if you can't afford, put away maybe 300 every month, so that should that need arise, you're able to go to a GP, and that GP is also able to refer you appropriately. Okay, let's say you can't afford the consultation fees for a private doctor, right? The one thing that I would do personally is to identify a small hospital, right? Because smaller hospitals are way better, besides the fact that they're actually cleaner, and the staff is more like friendlier because they're less overworked. And the nice thing about these smaller hospitals, some of these hospitals will perform like minor ops and things like that, but should the need arise for you to be sent to a bigger hospital, let's say a tertiary hospital, then they're able to discuss with the doctor who is receiving. You just have to make sure that the area in which you stay is covered by that hospital. At least you know someone in the area in which the hospital is based. Then you're able to write down that address. Number 4, try to not have a bad attitude. Try by all means, because the moment you respond in a certain type of a manner, baby, the sisters don't play, no matter how annoyed you are, because trust, you will be a bit annoyed. Calm down, calm down. Okay, the moment you're nice towards the people, they also will be nice towards you. They'll even like hook you up with stuff, with like a plug for you to charge your phone, a charger. They'll even like, it'll make your life so much easier. And I say this because they can make life really difficult for you. Number 5, with regards to specialist referrals, right? Let's say you have a condition that requires you to be seen by a specialist doctor. It's much faster if you go via the GP route, right? The GP will then refer you to a public facility that has that specialist doctor. In this case, the nice thing about seeing a specialist is that you don't have to wait the lines, especially if you booked. There's a set number of people that are booked, and literally everywhere in public, you don't really have to suffer that much. And the weird thing about like specialists is that you'll pay 1,500 to 2,000 to see a specialist, and the very same individual you will see in public for free. Number 6, right? So let's say you are a person who had medical aid and you sort of kind of prefer, or let's say the type of meds that you're on and not always available in public. So the other thing you can do is you can always just go to public, instead of having to go see a GP and then pay for the medication. You can literally just take one day off and go see a doctor in public. So they'll write a prescription for you without having to pay for also the consultation to have a doctor just write you a script. And you won't have to go in every month. They can just write the script for maybe 6 months, and then you just go in twice a year to have it reviewed. So number 7, so this one applies to the people who maybe have medical aid, but their medical aid has a ton of exclusions, especially when it's things that come to maybe dental care or things like physios, or for you to be seen by occupational therapists. When your medical aid gets depleted, you can have your doctor write you a referral to a public hospital, or even call to make a booking for you to be seen by maybe occupational therapists or physiotherapists. In that case, you don't have to cough up the fees. There's no long lines, everyone's booked, everyone knows what when they're gonna be seen and things like that. Yay guys, medical aids don't play. They spit you out like wildfire. The moment your funds are depleted, you are literally nothing to them, which is literally the saddest thing to see, especially for some of us working in public hospitals. We see that a lot, where they literally send you out in a stretcher because your funds are depleted and you can't pay for a CT scan, which you probably don't need. So with that being said, it's up to you. If you're a person who likes things to happen pretty fast, then I guess you have to pay for that. If you're a person who likes aesthetic, when it comes to level of care with the people or the specialists that see you, they literally A grade. There's absolutely no difference. If anything, you find that in public hospitals things tend to be a bit better because the doctors are not money hungry, so they do things that are necessary. Thanks for watching. I hope these tips were helpful, and that if you're a person who actually doesn't have medical aid, you're able to, I hope you are able to get some tips on how to save money and still get, you know, the type of care that you want based on your needs. So yeah, I will catch you on my next video.